So my name is Alicia Doyle and I work at the O'Leary Health Center in the Primary Care Network West. And I've been working here since 2011. So I want the people of West Prince to know about primary care since it's a new role. I work on advocating and advertising and marketing and trying to get people to come and access primary care since it is a new role in nursing, a newer role. It's nice to, I know I'm always trying to present to the public, to advertise and just to familiarize people with what's out there in primary care. So again, promoting health is a big part of my job, and keeping people well is a big focus. So it's the community perspective of keeping people healthy and informing them and informing them how to gain control over their health and be an active participant in their health. So in a primary care network, it's excellent that we do have quite an expanded role. So all kinds of different things are done here as primary care nurse, ranging from it could be an ear syringe, it could be an injection, it could be a vaccination, or maybe some education on blood pressure, cholesterol, COPD. Maybe I guess I'm trying to do PAP, so it could be a PAP, educating about this appropriate screening that needs to be done, at what age you start and what age do you stop. And so yeah, that's kind of a quick glance of what can be done as a primary care nurse in the day of a primary care nurse. Also managing INRs, changing doses of medications is also a big part of that as well. I guess as a leader at the clinic here in O'Leary, I do a lot of advocating for patients, and I'm working collaboratively with the patient and also with other professionals to provide the best care for the patient. I talk with the patient first off to kind of find out where they sit with their health and what areas they'd like to work on, and then I also can then advocate for them in collaborating with other health care professionals, such as their physician or their pharmacist or their nurse practitioner, or all kinds of different people to allow them to be involved as well and to guide me along with the patient with what they'd like to do with their health at that point. What drew me to the nursing profession is wanting to help others. I think I enjoy spending time and helping others in any way that I can to make them feel better and hopefully prevent them from feeling ill, and then also help them hopefully to feel better when they are ill if they should get sick. My first thoughts about going into nursing, I guess, is just what inspired me to be a nurse too is just there's so many different avenues with nursing. You can do community nursing, you can do acute care nursing, you can go many different avenues, and so I really like to not be limited to what my job would be, to also just to be able to do nursing as a base and then go wherever from there. I like the endless possibilities. I like the future of nursing and where nursing is headed. So again, the primary care, the focus of keeping people healthy, and also I like to motivate them to take control over their own health and to be part of that process with them, to help them, to educate them, to show them their resources, what's available to them. So I thought that was such a nice way to see, because it impacts everything down the road. If you can keep healthy, there's not as many admissions, there's not as much sickness, so it's very nice to see. And then I really enjoy too seeing them actively involved in taking control over their health. It's excellent, because then we are only human, but this, or can you tell me about this today, because they're really being active in the visit, and that's great to see, and that's what motivates me. I guess seeing the result, the most gratifying part of my job is probably seeing the results. You know, when people come in to see me and maybe their cholesterol might be up, their blood pressure might be up, they might be on their way to diabetes. So then to educate them, to show them about the guidelines and where the numbers are supposed to be, and then to see the people just take that information and run with it, to go home and make lifestyle changes, to look up stuff, to look up resources, diet, and then to see them come back, the pleasing results, you know, of seeing their numbers down, and they're like, wow, you know, I did that on my own. So it's really, that's the best part of my day every day, for sure. I really think that primary care nursing is such a valuable part of the team and to the clinic here, because I think some ways we can be the middleman in a way. We work with the patient, we find out where their needs are and what they'd like to focus on for that visit, and then we can kind of discuss, collaborate with other healthcare professionals to see, you know, this is what I've met with this patient and this is what we discussed, and here's where the patient would like to go with this visit, and what are your thoughts and how can you help us with this journey. And then, you know, the physicians are so receptive, the nurse practitioners are so helpful. They give guidance and, okay, this is what my thoughts are, why don't we give this a shot, and then, you know, you can go back to the patient and say, you know, all right, we discussed it and we're really trying to keep you in control here, and this is what we've come up with, what are your thoughts? So yeah, so I find that it's kind of nice that we can access other professionals. Sometimes, you know, there can be some wait times to get in to see the doctor or your family physician. They're really busy. They have a lot of jobs that they get done in the run of a day. So it's kind of nice that we can meet in the middle and discuss all the issues and then bring that back and forth and work together on that. The value of an RN to the healthcare team is really key. I think that we have the time to sit and to communicate with patients, to educate, to study the guidelines, to come out with the more recent guidelines, to educate the patients about these guidelines, and also help them to be an active participant in their health. We have the time to spend with these patients and the knowledge to back them and guide them along the way. So it's really key that, you know, that we can do all this, the education and keep up in the practice, and then also have the knowledge base to advocate and to educate and to help them along that journey, and also to collaborate with other professionals. I think primary care is a new and advancing role. I think there's all kinds of learning and autonomy, you know, with adjusting doses for blood thinners, to manage INR clinics, the whole entire clinic, to educate patients, to go ahead and take on those roles that were once done by a physician to help gain access to physician appointments, you know, such as PAP testing. We've been all trained to do PAPs now here at the health centers. We're doing, you know, teaching, we're promoting classes, we're providing healthcare classes, COPD classes, we're doing stroke classes here. We've all been trained in a lot of different areas to really educate and to take that stand on doing those roles that make a difference. We do, you know, ear syringing now, we do treatments for warts. There's all kinds of different roles, new and arising. Each year, really, you know, at the first of the year, we're looking, okay, where are we going this year? What are we tackling? What are we going to take on? You know, how are we expanding our role? How are we really keeping up to date with the, you know, new and advancing aspects of nursing? So it's great to be part of that, to see, you know, COPD, hypertension, dyslipidemia, high blood pressure, diabetes. You know, we're really taking an active part in helping manage these chronic diseases, which is something that I don't think was done in past, but it's nice to see the RN role expanding in these areas. I think a lot of the time now with the education piece that we are providing, we are educating the patient to take control of their health, and now a lot of the times I'm kind of seeing patients regarding their blood pressure, their cholesterol, or their diabetes, and they're taking control to make lifestyle changes, so therefore we're not needing as many medications. So then that is a nice place where I can monitor that patient and work more independently if there isn't any medications needed at that point. So it's kind of a nice opportunity to work with the patient on a one-on-one basis, but then also have my colleagues there when needed. I feel inspired as a nurse. I really am a nurse that enjoys seeing change and the advancements and the expanding roles of RN. So I think, learning all the time, taking this course, always reviewing where am I at now, what courses do I want, what training do I want to do, how can I help the population of West Prince, in what ways, where can I next learn, what's my next journey, what's my next at whatever I might want to tackle at that time. It's really, it's very, I talk about, how pleasing it is to see the results when I, do the teaching and do the training and provide the services we provide here, and then in turn see the patients with, allowing them to be an active participant, and then to seeing the results on paper is really what drives me to come back every day. It's what motivates me in my job. I think that pretty much covers it. I'm just happy to see where Health PEI is headed.